Everybody, we're so glad that you're all here with us. We'll get our background music off here.
And it is a beautiful day. Hi, I'm Dr. Jim Mazza.
And I'm Dr. Liz Dexter Mazza. Thank you so much for joining us today. Can we just get a thumbs up that you can all hear us and see us? Good morning. Oh, great, Kayla. Thank you so much. So we are so excited that you are all here with us today, and we are going to talk about our upstream approach for social emotional learning in middle and high school students. Really important to us and kind of at the mission of our hearts about how do we focus on building mental wellness in our students in this post-pandemic world. So really grateful to all of you for being here. Again, I'm Dr. Liz Dexter Mazza. I'm a clinical psychologist. I am one of the co-developers and authors of the DBT Skills in Schools curriculum, also referred to as DBT Step Say, Skills Training and Emotional Problem Solving for Adolescents. Jim and I have been working on developing how do we get the skills from dialectical behavior therapy into schools for about the last 10 to 15 years. We often refer to it as our first conceived and last born child.
Correct.
And so we're just excited that you all joined us to hear more about it. We're going to have a great day today. I know some of you are asking about our workbook. There'll be one sent out to you at the end of the day. Sorry, we weren't able to put that in the email this morning. Why don't you introduce yourself really quickly?
Dr. Jim Mazza. I'm a University of Washington, Seattle professor in the area of school psychology. So I teach graduate students at the educational specialist and PhD level. And I've also developed 2 courses for the undergraduate students called Wellness and Resilience for College and Beyond. That's one course. And the second course is Thriving on the Path to Happiness, that uses these exact same skills.
So great. We are glad you are all here with us. And we're going to kind of just jump in with a couple of we've got a slide presentation to go through with all of you to kind of walk through this material. And feel free, if you'll notice, there is a questions bar that you have that you can, rather than just put it in the chat so we don't potentially miss it, you have a questions bar where you can put specific questions in there, and we'll be able to kind of help go through and make sure we're answering your questions throughout the next hour. So thanks so much for being here with all of us today.
All right, let's go.
All right, so let's go here.
Yeah.
All right, so let's start with, so glad so many of you are here. Let's start with why an upstream approach and why DBT in schools now. You know, we live in Washington State, and here, as I want you to just see, this could be true for anywhere in the world today. Back in the end of February, the governor of Washington State, Governor Jay Inslee, declared a state of emergency in the state of Washington based on our youth mental health problem. And I'll just read it for a moment because I think it's so important that we went into a state of emergency. We often hear about state of emergencies for when there's natural disasters, when there's a flood or a hurricane, things like that. And here it is because of our youth mental health. Whereas hospitals and health professionals who specialize in the treatment of children indicate that many of Washington's children and youth are experiencing a significant mental and behavioral health crisis as a result of this ongoing pandemic, which has been exacerbated by the continued isolation, difficulty engaging with virtual learning, and lack of regular in-person interaction with educators, school personnel, mentors, and peers. Okay, because of that, he did the state of emergency and mandated that schools go back in person here in March. So that is one of the big parts that we're kind of really struggling with here, is that we know that during the pandemic, emergency room visits have increased. Depression, anxiety rates in our youth as well as our adults. Self-harm and suicide rates have increased. Social isolation and loneliness are pretty significant. And substance use, abuse, and self-medication have all increased as well. So those are all things that we're really wanting to make sure we're paying attention to. And that's why we think it's so important. And a couple other key points that have happened is I'm often, working with young people and hearing this question, who am I? Right? Where am I struggling? Because in this last year, there's been so much question about development through self-isolation. Where do I belong? How do I connect with other people? And what's really been driving Jim and I, as we've been working with schools and parents all through this last year, is that we know that parent mental health has been a struggle. So we know kids at home full-time are also struggling. just because of modeling and parents' mental health. We know there's been food insecurity that has been occurring in this last year. Again, things that families are having to really struggle to think about why we need to be working in schools so much. In this last year, there's been a 31% proportional increase in emergency room visits for teenagers compared to 2019 for mental health related visits as compared to non-mental health. So we know hospitals are seeing a lot more kids in the ERs for mental health difficulties. And because there are not enough acute psychiatric beds, they're often spending days in the hallways, having to be referred out. And outpatient providers also are overwhelmed and have high wait lists. So it's really hard getting our youth into treatment if they need it. And especially knowing that 20% of American youth have some degree of depression, 30% is substance use disorder, and another third suffering from anxiety. We're hearing about this, we're seeing it in a lot of kids that we think it's pretty significant. The other thing that I think is really important that we need to pay attention to is that there was a recent meta-analysis and research review done that looked at past forced isolations in different countries. And the biggest take home from this review of multiple studies showed that after forced isolation, we'll most likely continue to see increased rates of depression and anxiety for up to 9 years past the isolation piece. So that means that the impacts on mental health for our kids isn't just a problem now, it's going to be a continued problem as we go back to life, back to opening up things as well. And I've already mentioned that other piece about the emergency room visits before. So I just wanted you all to see that. Okay.
So I'll jump in here. So I think we have to do things a little bit differently than we have in the past. All right. And so what we want to be able to do is we want to be able to look at our, the way that we assess kids' mental health needs has traditionally been along psychopathology, symptomatology, right? So it's about the symptoms that they have if they're not feeling well, if they're anxious and so forth. And so that still remains, and that's likely has increased. Shannon Souldwell at the University of South Florida was able to also show that it's not the only marker though. What we also should be looking at is, do kids think that they have a good life? Do they think that their life is worth living at this point? It has good what we call subjective well-being. And interestingly, when you put subjective well-being, lay it over the symptomatology ones, right, we get 4 squares. And what's important about that is that we often are missing kids that are in this bottom right-hand square where they're not showing a lot of symptoms, yet they think that their subjective well-being is really poor, that they're not happy with their lives. And so we've got to figure out a way to make sure that we're capturing them. And one of the ways that we talk about in trying to capture those kids, because our assessment instruments as a school psychologist aren't picking them up, is to provide universal interventions or universal social emotional learning curriculum. And that's what our DBT Step Say curriculum is trying to do. All right. And so let's, and I just put some percentages there for the different quadrants that you have. So next slide. So in looking at this, and we know that the accumulative trauma that's happened due to the pandemic and due to things that are happening in our kids' lives, we also know before COVID-19 that the rates of anxiety, the rates of depression, the rates of suicidal behavior were increasing in adolescence already. And so what we're trying to do is figure out a way that the schools aren't reacting to what's happening, waiting for these kids to get depressed, waiting for these kids to get behind, waiting for these kids to start failing in school, right? Or to start engaging in self-medicating, self-harming, and suicidal behavior. We need to find an upstream approach. So this picture of this river is, we don't want to start intervening with the kids at this last rock dam here, just before the waterfalls. We want to go way back upstream. And if we can, teach everybody some of these emotional regulation skills and basically put up a fence along the riverbank on both sides so that we don't let these kids get caught in the current. Because once they're in the water, once the current grabs them, they start moving downstream towards that waterfall. And that's what we don't want to do. We want to try to prevent that from happening as much as possible. And so we're going to work on trying to build an upstream approach that's way up at the beginning before the current gets really steep and before it gets really fast.
And I'm trying to change the view for all of you. So I will keep working on that while Jim is speaking.
All right. So next slide.
Yeah, hold on.
Okay. So the next slide shows, if we look at a multi-tiered systems of support framework, how we know what some of the mental health difficulties are going to look like, and then we overlay that with what can DBT Step Say do. All right, and so here we start off at that high risk, that targeted or indicated level that we've talked about at tier 3, and we have kids that are going to be already engaged in substance use, engaged in self-harm, suicidal behavior, anxiety, depression, and severe collective trauma. We know that's going to happen.
So they're having a hard time reading the slides because they're small. So just kind of assume that they're not seeing slides.
Okay.
Okay, as we go through this.
Okay.
Okay.
And then so the application for DBT Steps A at that tier 3 level, that indicated level, is the curriculum plus some of the individual DBT informed counseling strategies that you can use. And so that if you're working on that one-to-one basis, that they get a baseline of skills, and then you, the school counselor, school psychologist, school social worker, can then use some of these DBT informed counseling strategies on a one-to-one basis to pull out those skills and have them practice those, right? The idea is to be able to have these kids practice these skills while things aren't problematic for them yet, so that they get more refined and more effective in the skills. So once something does happen, they have some experience in using that skill effectively. At the tier 2 level, right, what we call selected, all right, these are kids that are at risk for loneliness, substance use, bullying, maybe antisocial behavior. And here we've got DBT Step Say being used in a small group format. And that's been a common way that people have been using sometimes the Steps A curriculum, especially when we have some of these school counselors and school psychologists using small groups as an avenue to deliver some of those skills.
Okay, here we're loading the slides up into here, so we're getting that.
And then finally, the tier 1 level, which is where we would think Step Say has its biggest bang for its buck, is at that universal level, so that everybody gets this. And so why that's important is because there are going to be some kids who are doing just fine for right now, yet we know during adolescence times that things do happen, that drama does come up. And so this becomes a mental wellness promotion level versus the tier 2 is a prevention level, and the tier 3 is actually an intervention level. So we're able to cover all 3 of these levels that are part of that prevention paradox that Mark Greenberg has talked about. And so that we're able to help kids establish a toolbox that works on skills that work for them before things get really problematic. All right. And so let's do the next slide. So what does this look like? So DBT Steps A is a curriculum designed for that universal level for general education teachers. So not necessarily a school psych, school social worker, or school counselor. They can teach it. That's fine. It actually, though, you don't have to have any extra mental health training, right? And so what we're trying to do is get it into part of the general education curriculum so that emotional regulation and coping strategies becomes part of the skill set of all the kids. And so as well as algebra, Spanish, language arts, art class, something along those lines, all right? And so who's our ideal teacher? It's a motivated teacher. We want to make sure that we have professional staff, maybe your school psych, your school counselors or social workers can be supportive of a teacher that's teaching it. The lessons are all scripted so that we tell you, spend 5 minutes here doing this mindfulness exercise, spend 3 minutes here introducing this skill, spend 8 minutes here teaching this skill, all right? So we want to make sure that we help the teachers as much as we can while also providing some flexibility. So if the teachers have more examples that apply to the situation, we want the teachers to use their examples. We want them to be able to teacherize it, what we call teacherizing, for the applicability to their students. And then finally, there is a teacher manual and there is a student workbook that they have. All right. And then on the structure, it's designed for roughly a 50-minute period. There are 30 lessons in our standard curriculum. It's flexible in that if you need to spend more time on certain lessons and certain skills because your kids need those skills, go ahead and do that. It's formatted like a classroom. So we kind of would like to see it look like a class. We would like to have it graded like a class and count for your GPA. And that covers the 4 skills of mindfulness and motivation. It covers interpersonal effectiveness, and it covers distress tolerance. And then it's standardized with our Rathis and Miller DBT for adolescents that is an outpatient therapy and an outpatient skills group. And so that way, any kids that are seeing and receiving services that are outpatient in DBT will hear the same language, see the same skills happening in schools. All right, next slide. So here is a view of this.
So it's controlled here. So just
Okay.
keep going. We'll
So
move to the next slide.
All right,
Yeah.
next slide. So here are the skills that we have in the DBT Step Say curriculum. And so you can see there are the 4 modules. We've got mindfulness, distress tolerance, emotional regulation, interpersonal effectiveness skills. We also have 2 lessons that happen at the very beginning about an orientation. All right. And so, and then we also have dialectical thinking. So those comprise our 30 different lessons that are there. All right. And so, and next slide. So one of the things, because these are the dialectical behavior therapy skills, we're not doing therapy in the school here, we're teaching the skills, it's important to realize what is different about DBT Step Say from other SEL programs. And the answer to that is that we focus on kind of on a teeter-totter, where what skills do we use when is answered by acceptance versus change. Do I need to be in a spot where I'm accepting my emotions because it's really high and I don't want to make things worse, which would be our distress tolerance skills, and our my self-awareness skills, which would be mindfulness? Or do we want to change the emotion that we're experiencing right now because it's sad, or I'm feeling guilt, or I'm feeling envious? And so that's over on our emotion regulation side. So we've got a decision-making tree that we set up in the curriculum that provides us which side of the teeter-totter should we be on and why. And I think that becomes really important.
Sorry, I know we're a little delayed on the slides. There's like a background piece that's happening. We're trying to fix that. You guys will get a copy of the slides emailed to you after today. So I do apologize for the technical difficulties that are occurring as we kind of go through this. Okay. So if we could advance one more slide, that would be great.
Let's go 2 more slides.
So we're going to move over now to, we've got our background folks helping us out, Eve and Julie, on slide 13, please.
That's the one I want.
So, okay.
Great.
All right, one more slide there, Eve. Thank you.
So what with the DBT Steps A curriculum also aligns with the 5 CASTLE competencies. And I think that's important, that people often go to the castle.org website to look at social emotional learning. Great website that are there. And I wanted to highlight here that we have been able to show that these that we have skills that hit every one of those 5 competencies. And right now, I'm hoping that you're looking at a table of those 5 of the 5 competencies with each of the DBT Step Say skills aligned there, so that you can see that we're covering those things. All right, next slide, please. All right, great. So this is a slide that shows, does DBT Step Say work? All right, and in this slide, we're looking at a study that was done over in Ireland. They received this curriculum in 2015, and they then put it into their schools in Cork, Ireland, and they had several schools that didn't get it at all. They had school as usual. And the red boxes here are the DBT Step Say curriculum, and the yellow boxes are kind of that control group. And you can see here, looking at the statistics and the effect sizes of those red boxes and those 2 right-hand side columns, that the emotional symptom index and the internalizing problem behaviors were significantly lower after kids received the DBT Step Say. So the graph is actually pre-post. It's actually the changes that occurred between the start of the curriculum and the end of the curriculum during an academic year. And the drop in kids experiencing emotional symptoms and the drop of kids experiencing internalizing problems was significantly large compared to school as usual. And those are large effect sizes. Next slide. Perfect. This is a slide of what was happening with behavior referrals from one of our schools in Staten Island. All right. And so here we were seeing, before the Steps A was implemented, that we were seeing an increase in school behavioral referrals for 31 kids. So between 6th to 7th grade, before it was implemented, they had 1 student who had less behavioral referrals. They had 30 who had more behavioral referrals. After implementing Step Say for that 1 year, they now have the referrals had dropped significantly. So it flipped over. 25 behavioral referrals were less, right? They had 25 kids who had less behavioral referrals, and they had 6 kids who had more. And that statistic is large. It's significantly different. And so we're seeing, even with antisocial behavior, some of those externalizing behaviors making a difference as well. So this gives kids a tool that they can use during that time. So it significantly reduces some of those behavioral referral issues that our principals and our teachers get frustrated about because they keep referring to those things.
Great. I love the questions that you're all asking. Here we go. We've been able to fix up the screen there a little bit. I just want to take a moment and answer some of the questions. Some folks have asked, can like our standard 50-minute lesson be divided into 2 25 or 30-minute sessions? Yes, you can teach one lesson over 2 shorter periods a week. There's lots of flexibility built into that. And when we do trainings, we spend time with schools and collaborations and consultation on how we can break those pieces up. Several of you have also asked, I just want to answer like that you've heard that there is an elementary curriculum in the works. Yes, we are in the works of adapting our middle and high school curriculum to an elementary. We've had lots of schools who've already been doing some adaptations themselves and doing that. So we're happy to talk with folks about that as well. So great. What I want to do now is just talk for a few minutes and then make sure we have time to get back to all these great questions you all are asking. And again, appreciate you hanging out with our technology pieces here. I want to talk about some of the skills that we specifically do teach and why we think they're so important. So if we can go ahead to the next slide 17, that would be great. So what I want you, we'll get that slide advanced in just a moment. And what we really want to talk about is the skills that we spend so much time talking about are mindfulness skills. And in our mindfulness skills, a huge piece of that is that I always think what we pay attention to is what we see more of. And we want to teach our students and our adults, of course, also what they pay attention to. And I often think of this idea of mindful intention, that as human beings, we have a tendency to pay more attention to the negative things that go on in our life, to pay attention to what's not going well, the problems that we have, versus paying attention to joy. So one way that we teach mindfulness and wrap it around is this idea of what we pay attention to is what we get more of. So how do you focus on noticing more joy in your day? We teach our students to focus on like gratitude. Like, how do you pay attention to where gratitude shows up in your life every day? And how do you pay attention to places where you build mastery? Building mastery is the skill we use when we're talking about the idea of learning that you can do hard things. We teach students that, can you do something that's a little bit hard or that you don't particularly enjoy every day? So when you're done, at the end of it, you feel a greater sense of competence and confidence. And through mindfulness, we help our students to pay attention to seeing each of those pieces day to day. And I think that's a really significant thing. Like, we even do that in our home with our kids. Like, every night around the dinner table, everybody has to go around and say 2 things they're grateful for that day or brought them joy, and 1 thing they built mastery in. It's one of the ways we try to generalize from social emotional learning of what they're doing in school to what they do at home, and kind of bringing that through. So that's one way that we take mindfulness from what's typically taught as, relaxation, calming breaths, to how is it relevant to your life every day? And part of it is we want our kids to pay attention to the joy and the hard things they experience every day as a place of growth. And if we can move to the next slide, please. The next thing we're going to talk about as another mindfulness slide that we teach about is this concept of our 3 states of mind. Mm-hmm. Mindfulness helps us to recognize when our emotions or our students' emotions are running the show. And we call that emotion mind. And why I think it's so helpful that we call it emotion mind is because we're building a common language in schools and in families that when you feel like your emotions are in control, when you're making decisions from your emotion mind, they're emotion focused and they're not based on reason or logic, which we talk about as reasonable mind. And ultimately, what we're helping our students to really find a balance and understand is, how do you access your wise mind? When you can hold up both reason and logic, and along with your emotions and your values, and make hard decisions from there. And so in our mindfulness skills, we're going to teach our kids how to pause, that moment between I have an urge to do something and I do it, to find that pause in the emotion before they act on it, to do just one thing, to practice being non-judgmental of themselves and of others, because we know judgments fuel the intensity of emotions. And most importantly, my favorite skill that we teach kids is how to be effective. And being effective is asking yourself the question, is this behavior that I'm about to do in line with my long-term goals? Is it what I want now, or is it what I want most? It helps kids to stop and pause and think about, is this behavior helpful? When, a teacher yells at me or I get in trouble and I have the urge to make some obnoxious, sarcastic comment back, to pause and ask, is this effective? Is this in line with my goals of what I'm wanting to do? And we strategically and skillfully break that down behaviorally to what skills the students can use to help regulate their emotions and affect their behaviors. Next slide, please.
So I'm going to jump in here just for a second. You can advance the slide if you'd like. Perfect. The mindfulness piece, we've heard a lot about it. It's been kind of a buzzword the last 8 to 10 years. There's actually another curriculum called Mind Up as well that we know works. The thing about mindfulness is that it's core to all our other skills, and that we need to have our mindfulness, our self-awareness, so that we know what our body's telling us, what our brain's telling us, and where we are at that moment, which Liz is going to cover in this slide right here. The thing about mindfulness is it's not enough to just be aware of what's happening, aware that you're feeling this situation, aware of what emotion you have. And so once you're aware, then what do you do after that becomes important. I think that's where there's an added benefit to some of the skills that are in DBT Step Say.
Great, thank you.
Yeah.
So let's talk about a couple more skills, right? We always ask ourselves, like, okay, so the kids are learning these skills. How do I coach myself or my students when they're struggling with painful emotions? And that's where we often think about the emotion intensity that we have on a scale of 0 to 100, or if you've got younger kids, it could be a scale of 0 to 10. And we think that 65 is kind of that skills breakdown point. It's a point where like emotion mind could potentially start taking over for kids. And one skill we teach them is effective distraction. When your emotions are so high and you're having a hard time not acting on them, how can you effectively distract by mindfully shifting your attention to do something else, either another activity, by doing word puzzles, just changing your thoughts, changing your behaviors, as effective distraction. We know many teenagers are like expert distractors and avoiders. We want to teach them to do it effectively at the time when emotions are high. The other thing that I think is really important that we teach kids, and this is like, I think, the core of what all kids need to start learning now, so that they have this through their entire adulthood, is this idea of how do you, we call it the wave skill, sit with and experience an emotion like a wave, right? I think it's important that we teach kids how to embrace discomfort. Because the thing that most of us don't like about emotions, about being sad or experiencing shame or guilt or fear, are the physical sensations that we have in our bodies when we have them. When I have shame, it is this heavy, hollow weight on my chest that I don't like how that feels. I'm really uncomfortable, and I often want to push it away. However, if my shame makes sense, if I did something that I should be embarrassed about and I have to repair that, I want that shame to communicate that information to me so that I can then repair and fix it, whatever the transgression that I made was. And that's important that we teach our kids, that they can notice their uncomfortable sensations in their bodies. They can sit with them and experience them. Don't always have to push the uncomfortable emotion away. So that's another one of those important skills we teach, just to give you some examples.
And adults do the same thing, right? Adults try to push them away as well. And so just trying to model, if you're an adult, if you got kids at home too, is to, to be aware that, that maybe I have to sit with this. And that if it's a sad situation, then it's okay to cry, and try to model that you can sit with some of these emotions.
Great. Thank you. And then next slide, please. And I'm just, while we go to that next slide, I'm going to try to answer Katrina's question here. But it says mindful approach would work as long as the person has access to their reasonable mind. But if they're overwhelmed with emotion, instead of trying to force a shutdown, a different skill would be to invite rational capacity into the realm of the emotions, right? And that's kind of where we're really bringing in, Katrina, this idea of wise mind, of how do we hold on to both our reason and our emotions at the same time. And sometimes those emotions are so high that we have a hard time getting our prefrontal cortex, is how I often think about it, is where all of our problem solving and decision making happens up here. And then we've got our amygdala and our limbic system back here running our emotions. And when our prefrontal cortex is offline, we've got to use skills and strategies to get it back online, to get those pathways between those two parts of our brain opening up again. And we actually have a whole set of skills, which I don't have a slide for here, called the TIP skills, which is how do we get our prefrontal cortex back online by bringing the really intense emotions down quickly through changing our temperature body, doing intense exercise, and doing paced breathing. Those are all pieces that we can do. And as adults, we can be coaching our kids in schools to use those skills.
And I think it's really important. And what Liz just talked about as part of the TIP skills, it's one of our crisis survival and distress tolerance skills. And that's where I think we have a big difference in other SEL programs as well, is that when kids are really struggling with their emotions and they're really high, above that 65, there are actually a set of skills that you can use instead of waiting for the person to become more rational and waiting for them to calm down. Because if you talk to an adolescent and you say, you're being irrational, they're just gonna be like, no kidding, right? They're gonna just tell you that right there. And so we've got skills that help with that instead of, having to wait for them to come back down underneath that 65. And I think that's really important because that's part of that acceptance piece.
Exactly. And then the other next skill I just want to talk about, because we often talk about, with our kids, how do they decrease their struggles and how do we help them in the moment when their emotions are high. We also spend a lot of time talking about how do you decrease your vulnerability to your emotions by taking care of your body over time and making daily deposits into your personal emotional bank account. By taking care of we have what we call the please skills. And if any of you have been involved in comprehensive DBT or even seen our DBT Step Say skills manual, you'll notice that we've changed the please acronym a little bit in our current revisions, in that the P stands for maintaining physical health and the L stands for limiting screen time. We know intense amounts of screen time have an impact on our emotional vulnerability, especially for our kids who are still developing their prefrontal cortex, until they're young adults. Teaching kids how do you eat a balanced diet and avoid overindulgence. For our older kids, we'll also say avoid mood-altering drugs, get a balanced level of sleep, and get exercise daily. And kind of really moving through this with all of them to teach different ways of what is balanced eating, what is balanced sleep, how to move your body. And we have moving your body as parts of 3 different skills throughout the curriculum because they can move your body for different purposes each time, which will be really important. And so this is just a smattering of a couple of the skills. We're happy to answer more questions about them and go through more of them if you have questions about it. But if we can move to the next slide, I want to make sure we kind of finish up these last 3 slides and then answer lots of the questions we have from our group.
Keep the questions coming. They're great. Next slide so as it's coming up, the next slide talks about why DBT in schools. Why is that going to be important? So one of the reasons is that it's taught by a general education teacher or staff member. So we want it to be part of the universal educational curriculum, where decision-making and coping strategies are a part of the educational process. In this way, we're not teaching just to the academic child, which is the algebra, Spanish, language arts, right, history. We're also teaching lifelong skills and well-being skills that are part of what our students are going to need as they go through each day, each week, and then the years to come. And these skills then are also used as an adult, all right? And so we want to emphasize educating the whole child at that point, all right? The second skill here or the second reason why we should be doing this is to provide the skill specificity that helps us with generalizing to the general environment. So part of our castle model is how do we change the school environment as well. And so if everybody knows what a tip skill is, and everybody knows what pros and cons is, and everybody knows what a dear man skill is, then we're able to use those skills and those names to call upon a set of skills that all the students are going to know. So even if you're the math teacher and you're not one of the teachers for DBT Step Say, if you know a skill to help your kids when they're really struggling, you say, hey, use your best accept skills. That'd be great for a kiddo that's really struggling in math class without having them blow up and flip off the teacher and turn over a desk and make a big event out of it where they could possibly get detention or suspended. So it will help with that generalizability and recall of the students, all right? It'll also help that if I'm a really good friend with Liz here and Liz is struggling, that I can say, hey, you're really struggling. What's your best tip skill so that you don't make things worse right now? And then we can go back and Liz will say, well, it's exercising, doing running. And I'm like, okay, so good. Let's go run for a run for our 20 minutes, which is part of our tip skill. And so I can, as a peer, help her out with trying to intervene. And we know that's important because kids talk to other kids first. No matter how good of a therapist you are, no matter how good of a teacher, principal, school psychologist, whatever it is, kids rely on other kids first for support. And I think that that's important. And then we're hoping to change the language of the school so that we can see these big words. Like one of our schools has, mindfulness in these big 1-foot letters through in the hallway, just reminding kids of some of those skills. All right, next slide. Right. So we also want it to be adaptable to the immediate needs of our tier 2, tier 3 students. And so they're going to need some of those things. They already are at risk for some of these behaviors, or they've already engaged in some of those behaviors. So you could provide an 8 to 10 lesson protocol for helping highly distressed students depending on their needs. And I think that actually addresses one, I think Danita's question here is that, does it have to be all 30 lessons in the school year? The answer is no. It'd be great if it is. And again, that's at the universal level. If you're working with students at that tier 2 and tier 3 level though, you may not be able to have 30 lessons. That may not occur. And their uptake of the lessons may not be as quick as at the universal level. So I think it's important to remember that we're about behavior change. And we would rather see this DBT Step Say curriculum, 50% of the lessons taught, 100% well, so the kids get them, then 100% of the lessons taught all at 50%. So the idea is to help them build a toolbox in all 4 of those modules that work for them. And that's what's really important there. So there is some flexibility and adaptability there. Number 4 can be used with collaboration with other social emotional programs. So if you're already doing PBIS, Ruler, Second Step, Zones of Regulation, these all can be, they can remain. And you can supplement the DBT Step Say lessons as a part of that. And again, provide some of that skill specificity in the language that's there. And I think that would be important as well. And then finally, number 5 is it's adapted from DBT therapy. So we know that there's a lot of evidence and a lot of clinical trials that have shown that dialectical behavior therapy, the comprehensive type where you've got individual, you've got case consultation, you've got phone coaching, that whole comprehensive model has shown to be very effective than any other therapy that's there. So it's an evidence-based treatment for suicidal and self-harming behavior. And we've also seen some of these trials work with adolescents as well. And so we're taking what we know to be evidence-based and grabbing some of the skills that we think are really important because they provide and empower our kids with interventions that they can do for themselves. So it's specific enough to address the emotional pain that our adolescents often experience, which is really one of the primary drivers of why kids self-medicate, self-harm, and engage in suicidal behavior. And it's general enough to help everyday youth with the emotional difficulties and drama that are occurring in today's age. And so we kind of can get the best of both worlds by being able to apply it. And from our understanding, it's one of the first non-clinical applications of the DBT skills.
Fantastic. Great.
Yeah.
We've got lots of questions and I love what people are putting in here that I want to make sure we answer all these questions that people are asking about.
Let's get to it.
Yeah. So first, let me just, we'll go forward one more slide in just a moment and we'll just talk about several of asked like, what about training and where do you get access to training through this. And our next slide just talks about 2 trainings that we have coming up this summer that are open enrollment, live virtual trainings. In the last year and a half, we've been able to move to the live virtual format because of the pandemic. And it has actually helped us to increase the reach and ability for schools that weren't able to have more, bring us in, have private trainings for their small staff. We've been able to give a lot more trainings to folks. So definitely we'll love to see as many of you as possible at those trainings this summer. We have a 2-day training that's called DBT Informed School Counseling, which I'll talk about in just a moment, and our standard 3-day DBT Step Say training that people can attend. The 2-day DBT Informed School Counseling Strategies training is for school mental health counselors, school psychologists, social workers who could be attending and maybe are going to be supporting students who want to use some of the DBT strategies from dialectical behavior therapy treatment, not doing DBT in the school, but using some of those strategies to help them with their one-on-one appointments with students and how to coach students effectively as they're going through. So that's another option. There's lots of information on our website about that. And then I said there's the 3-day training. And so you have that information. Feel free to reach out to us, join our mailing list if you have questions on that. We'll get you lots of information about that. Another great question that somebody had that I wanted to answer is, have we thought about doing this in higher education yet, in universities and college students, so that students, one, who didn't get it in middle or high school can have access to it, or because all adults need this as part of being more effective?
All right, I'm going to take that second question, and I'm going to go back, though, to your first answer. So who should be attending the 2-day school counseling strategy training? Who would be attending that?
So we are school psychologists, school social workers, school mental health counselors. Your school counselors, if they're doing more kind of one-on-one work with your students above and beyond their general registration and college prep, but if they're the ones helping put out crises and manage difficult emotions, they would all benefit.
Right. So if you're part of the Tier 3 and Tier 2 delivery services, this would be a great training for you to provide, because you're working with some of those kids that are either at risk for some of those behaviors or already engaging them. Who should attend the 3-day training in August, the open one?
So 3-day training. So any teachers that you have that are going to be teaching the curriculum, and your school mental health staff that will be supporting, so they understand the same language, and maybe they co-teach the first year if that is more comfortable for your staff. Okay, before we get to the high school question, because there was another question that did fit this also. Do we ever get pushback from teachers about thinking we're doing therapy in the school? And that is a great question that lots of people often ask us. We sometimes do, and here's our answer. We're not actually doing therapy in the school.
Correct.
The curriculum, this curriculum of DBT Step Say, we wrote it for a universal population of students. And the lesson plans are all in there in lots of detail, broken down to what you're doing from minute to minute as part of the lesson, with scripts and examples of how you teach these skills to a universal population of students. We're not talking about kids with depression, severe depression, anxiety, life-threatening behaviors like suicide and self-harm. We're using examples like, you're in the middle of a huge football game on Friday night and you're the quarterback and you can hear the fans all screaming and you feel lots of pressure on you to get this next touchdown and you're scared and your emotions are going up. How do you use your mindfulness skills, your emotion regulation skills, to stay in the present moment, read the play, read the defense, and make the most effective skill possible, play possible in that? How do you use it when you just got into a fight with your best friend in an argument and you're about to walk into class and take a test and you can only think about, are you guys going to figure this out? And your emotions are high. What skill do you need in that moment? Or what skill when you go to your first job interview? That's how we're talking about. We're taking the evidence-based skills that we know are effective from DBT therapy, and we've pulled those pieces out and turned them into a universal non-clinical application.
Right, and there's a place for comprehensive DBT. And so, if you've got some of those kids that are beyond that Tier 3 service providing, then, there is comprehensive DBT for adolescents. And so I think that's certainly something that you can do at that point. If you're just beginning, if you're brand new to this whole topic of mental wellness and mental health, do you start at the 2-day workshop or do you start at the 3-day workshop? Where would you start?
I don't think it matters.
Okay.
I think we've got schools that figure out where is their best entry point into their school for buy-in, for staff, for cost effectiveness, that oftentimes I'll have schools send their mental health staff to the 2-day DBT school counseling strategies, and then they realize, oh, we want more. We want to go and do more of the 3-day. We want to teach the curriculum to our students, either in small groups, small classrooms, or in the universal. And then sometimes it's the other way, that they will send their school mental health staff first to the 3-day training and saying, okay, now that you're all trained, we want you to help co-teach with teachers, and then teachers come to a second training. So our ability now actually to offer these open enrollment trainings that more people can come to makes it helpful. It's a full 3-day training. We typically go like the 8:30 to 3:30 time period, or the ones in the summer, I think, are like 7:30 to 2:30 on Pacific time to try to hit multiple pieces.
Right.
That's when we do these open enrollment trainings, it's a per person attendance. We also do lots of trainings where we collaborate and do private trainings directly with specific schools and districts. Those are options too. It's not only the open enrollment.
Right. So schools often don't take a one-size-fits-all approach. And we try to work with the schools during our trainings to say, what is your school structure? How are you doing it? And then how can we best assist you in providing the model that would work most effective for your team? Mm-hmm. So I like that approach. All right. Your question to me was about the undergraduate class, mm-hmm. right? Or undergraduate skills, right? And so as we were doing some of these trainings for the high schools and middle schools, my graduate students were saying, hey, what about us, right? And it occurred to me, like, light bulb went on, like, yeah, hello, maybe our undergraduates and graduate students need some of these skills too. So I developed a class called Wellness and Resilience for college and beyond that started off kind of as a project that built in some of the DBT skills plus ACT skills, so acceptance commitment therapy skills and positive psychology. So there's 3 different evidence-based programs melded into one. And that class grew from 60 students last year, in 2017, and now we have over 400 students per quarter that take this class. And so, and we've also developed a second class due to the demands of the student wanting more and more of this, that they understand that they don't have this in their toolbox. They understand that they've gone through high school already and feel like, oh my gosh, I'm not equipped to cope with what's happening out in the real world, and my emotions are making decisions for me that I don't want them to do. So I think this really difficult in it's interesting, I should say, that kids are willing to pay for 5 credits. So at the University of Washington, that's going to be probably a couple $1,000s to take these classes where we could be giving some of these skills to these kids during high school, which we want to do because we know that the self-harm and suicide rates are going up in that age group. And so yes, it's being done, and so it's had a really good draw in helping kids in college.
Yes. Somebody asked that. Sometimes it's hard to get teachers to attend a training in the summer.
Yep.
We often hear that too. We're always trying to find a different time frame for when. Got some music going on. There we go. Sorry about that. When we're trying to time our trainings. So we will have this one at the beginning of August. For some schools that coincides right after they've started. Others it's right before. Some it's still in summer. We will have another open enrollment training in late October. There'll be another one. So we just want to make sure we did one in August as schools are coming back and getting ready to
start the new
year and put that all together.
Plus, it's coming out of a pandemic, right? So it's going to be the first full, what we hope, cross our fingers, that we're going to have students in person throughout the country.
Yeah.
Other questions?
Yeah. So let's see. As a librarian, I might like to try to get a small group and walk through the lessons with the kids for 30 days. Who would be ideal candidates for a pilot group? You know, it depends. As the librarian, I would say you're going to be thinking about, you could do self-selected kids who are interested in like taking a wellness and resilience course for success in high school and beyond, or middle school and beyond. I always recommend to people that you don't call it a DBT class, because that sounds very therapy and not very exciting. That you want to come up with a class title that is something, or a club or a group that would make kids interested and engaged. And then you just use the Step Say curriculum. Right. I always say, like, we teach, a pre-algebra class or a math class, but we don't call it the Singapore math class or the everyday math class, because that's just the curriculum we use. So you can come up with a name for it. And I would say as for the librarian, you don't want to hide all your tier 3 kids, because you're not trained, I'm assuming, in mental health there. So choosing kids who are interested, maybe kids who are having a little bit of different difficulty socially, maybe you pair with one of your school mental health counselors to do it as a tier 2 class. or take volunteers, or just take kids who want to have lunch in the library as part of lunch bunch and not in the cafeteria or somewhere else.
We often get questions too, and this might hit one of the questions that's here, is that do all 30 lessons need to be taught in that same academic year to get the same therapeutic benefit? That's what the research did in Ireland, and I think the answer is no, right? I don't think you have to do that. So we've got our Staten Island school, for example, teaches like 17 of the lessons in their 7th grade, and then teaches the other 18 lessons in 8th grade. And so that there's 5 common overlap lessons. And then but between 7th and 8th grade, they get all 30 lessons and all the skills in that regard. And so there's different approaches that you can use, because some of our students aren't going to have the cognitive abilities to be able to maintain the uptake of a skill as at a universal lesson. So you can slow that down to make sure that they actually attain the skill. And that's the most important part for us, is not the knowledge gain, not knowing the skill, it's actually practicing the skill. That's really important.
Yeah. And here's another question that was asked earlier on. Can we explain the difference between dialectical behavior therapy, DBT, versus CBT or REBT, cognitive behavioral therapy or rational emotive behavior therapy? So the way I think about it is this, is that cognitive behavioral therapy is a category of treatments. It's a type of big umbrella treatments. And then there are specific cognitive behavioral therapy treatments that focus on changing cognitions and behaviors. And they're very change-focused treatments. Dialectical behavior therapy is a type of cognitive behavioral therapy. And what makes it different from when it was developed in the 80s and 90s is that it doesn't just only focus on change. As Jim said earlier, it has a strong focus on acceptance as well. So we teach about how to change cognitions, we teach how to change behaviors, and we focus on acceptance of being in the present moment, of acknowledging what we can't change, or really being able to accept and acknowledge what is before we can change. And that's one of the core differences of DBT versus CBT, and really acknowledging that DBT is a type of cognitive behavioral therapy that falls under that umbrella.
Yeah.
As we go through.
There's also a question asked about any research on the connection between unresolved, unacknowledged, or unaddressed grief and the various acting out behaviors. And so I'm not aware of any that has crossed my plate. It does not surprise me that we would have this. And so one of the things that we do know is that DBT Step Say skills work really well with like trauma-informed CBT and work with trauma-informed schools, because it gives the students some of the skills to use as they're going back through their trauma history, as they're starting to experience some of that anxiety, or their bodies are starting to become hypervigilant due to the post-traumatic stress that they might have had. And so we can use language and skill specificity to help them in those moments. And so I think that there is certainly opportunities to meld those things together. I'm just not aware of the research as the question was asked.
Mm-hmm. Great, thanks. Nora asks a great question. Would it be redundant for a mental health professional, like a school social worker in a school, to attend more than one of the trainings to support all tiers in the school? No, it would not be redundant. We often have individuals attending both trainings, because the 3-day Step Say training is focused on how do you understand and teach the lessons, teach the classes in small groups of DBT Step Say curriculum. And the counselor's training is really focused on some of the work you do one-on-one, and then how do you coach your students in the Step Say skills, where we just go over a handful of skills in the 2-day, and we go more in depth to all the lessons in the 3-day. So that's an important one also. And it is open to both students and professionals. You don't have to be a licensed professional to attend any of our trainings as well. Let's see. Somebody asked, what are the qualifications needed to be able to teach this skill?
That you like your job and you like helping students. That's it. Mm-hmm. So you don't need to have a master's degree. You don't need to be a mental health professional. What you need to do is be there for your kids, that you're willing to be non-judgmental, you're willing to use some of these skills yourselves, and that you put yourself out there to help the kids. And so I think it's also helpful, and this is what I do in my undergraduate class when I'm teaching, is it's also helpful when you're vulnerable. And so I get up in front of an audience of 400 18, 19, and 20-year-olds, and I cry watching Inside Out, right? And so they see me crying watching some of these episodes because it's sad, right? Some of the clips. And so it gives them permission to experience some of those emotions. And so I don't think that you need to be you have to have so many letters after your name or whatever else.
And in some of our schools, we have like the behavioral support teams,
Yep.
often bachelor's level behavioral support individuals in the schools co-teaching or teaching some of these. I also have in one of my other schools, which is a weekday boarding school, where there are house parents that manage the boarding part. It's our house parents who are not even trained teachers teach the Step Say classes there as well. And that's part of how we wrote the curriculum when we developed it, is we wanted anybody to be able to pick it up and teach it. We know that the training and kind of getting the background and the is really helpful, especially for those who have less background in training it, is really important.
Right.
So I think we are just about out of time.
I think so too.
If there are any final questions I'm just looking at that we didn't get to, please let us know. So Tracy just says, I'm sure it's different for kids when they try to teach with SPMI young adults, embrace the ideas and concepts.
So she was talking about neurodiverse kids and how you can actually teacherize it to bring it down to levels for where your kids are. And we absolutely suggest that as well. We want you to make sure it's effective with your kids, not necessarily what's exactly in our book. And so I think that's important.
Yeah, I'm so glad that everybody's saying this was so helpful. Please reach out to us if you have more questions. Please go to our website, which is dbtinschools.com, and you can subscribe to our mailing list so we can keep kind of giving you updates on upcoming trainings, but also when we have new information to share with everybody. We'd love to see more of you and actually get in our Zoom. I will say in our 3-day trainings, we do it over Zoom so we can actually see all of you. We didn't know how many people we'd have here today, so we wanted to make sure we had everybody could access this. But the Zoom trainings are, the 2 and 3-day trainings are over Zoom. They're live interactive. We have big Brady Bunch screens where we can see all of you. We're asking questions. We do a lot of breakout rooms, small group discussions during all of that. So please reach out to us, ask questions, and then just a couple other places. If you want to see more of what we're doing, like I said, you can go to our website. I always tell people last summer, we did this really crazy thing, Jim and I, when our kids started doing school from home, and we decided that we were going to teach them this curriculum to them ourselves, since they weren't getting it in school. And so 2 days a week for about 14 weeks, we taught all of the lessons to them, and we live stream them on YouTube. So if you're interested there, you can go to our DBT in Schools YouTube channel and watch Jim and I teaching the lessons to our kids in our living room, which will show you how technologically challenged we kind of are of trying to figure out how to do all of that. And then we're also on Instagram and Facebook, where we post things regularly. And then Twitter. And I have a podcast called How Come They Didn't Teach Me That in Schools that you could also listen to. Thank you all for being here. We really appreciate you. We hope to hear more from you and to see you at some of our trainings, and just grateful that you care about your kids enough to think about their social emotional learning and to come spend the morning with us. Take care, everybody.
Yep. Thanks for working with your kids.
Yes. Thank you, Harry, who has 3 DBT Step Say group going on at his middle school, plus a parenting group. Thank
you for all your champion work, everyone.
All right, everybody. Take care and be skillful. Thank you. Tracy, we are not set up to do participation certificates for today. We didn't really think about that. Email us directly at info@dbtinschools.com, and we'll see what we can do there. All right. Thank you, everybody. Take care.
Final email, and if you get me a list of those who want the certificate, I can set that up for you.
Fantastic. Thank you, Eve. Great. So if there's anybody still listening that would like a certificate in addition to Tracy, and Tracy just email us, let us know.